my name is Danielle Lowe, and
I'm Christy Johnston.
and today we are going to be talking about animal-assisted therapy and
Veterans. Today we are going to be talking about occupational therapist roles in helping veterans and how the use of animals can improve therapy results. According to the U.S. Bureau of Labor, there are about 22 million veterans living in the United States. Of that 22 million, 5.5 million of the veterans are considered disabled. In many cases, returning veterans have undergone both physical and mental trauma, and more than ever, they need the talents and skills of occupational therapist practitioners. A recent study reported that about 19% of veterans returning home have signs of post-traumatic stress disorder, PTSD, and 7% of veterans returning reported having both a likely traumatic brain injury, a TBI, and PTSD or major depression. 30,000 veterans have been physically injured in Iraq alone. 10 times that are estimated to have PTSD. Many veterans also come home with amputations of major limbs and hearing or vision loss. Occupational therapists help veterans with daily tasks and life skills that have become more challenging since their return home. OTs help veterans transition back into civilian life, helping them manage their relationships and adapt back to their lives. OTs also help with difficulties with sleeping and also difficulties with driving. For the veterans who have amputations, OTs help them adapt to their new bodies and make any adaptations needed to help them be more independent and successful in their daily tasks. Another big part of occupational therapy for veterans is behavioral health, helping veterans control their behaviors and find strategies to help keep themselves in control. To help veterans achieve their goals and transition successfully back into their civilian lives, animal therapy can make a huge impact. The most common form of animal therapy used today are service dogs. Some veterans with PTSD can use service dogs to help with community integration. In a study conducted by O'Donnell and Menentis, human-dog interaction, including quiet playing, talking, petting, and focused attention, produced an increase in several neurohormones, most notably oxytocin. Increased levels of oxytocin have been shown to modulate psychological symptoms of PTSD and enable veterans to actively engage in social interactions, decrease anxiety and stress levels, and promote a sense of security. Service dogs also have dual benefits. It provides active duty service members and veterans with the opportunity to participate in highly focused, safe, and positive social interactions with the dogs. And it also allows them to encourage the release of oxytocin and have a better sense of well-being. Service dogs can provide care and support many veterans of different types of injuries. There are dogs for individuals who are blind or have low vision. There are hearing dogs for those who have lost their hearing later in life. There are service dogs for those with physical disabilities. Facility dogs as part of the rehabilitation process in military and VA hospitals. And also PTSD service dogs to help migrate the effects of PTSD in an effort to provide the emotional and physical support that they need. For a person with a serious limb injury, an amputation, or a traumatic brain injury, A service dog can provide stability, support with climbing up and down stairs or getting in and out of a chair, and can be trained to retrieve specific items. For example, they can retrieve medications, a wallet, or a phone, or anything that the veteran needs. Dogs can also be trained to alert for seizure response and assist with vision and hearing needs as well as many other tasks. The use of service dogs for physical disabilities is well established. Therapy dogs are increasingly used in disaster settings. Evolving trends include the expanded use of dogs for wounded soldiers and other service members and veterans, the use of dogs in overseas combat, theater to assist the combat and operational stress control, therapy dogs to assist with PTSD and other behavioral health issues. Here are some accounts of veterans who own a service dog. A soldier who suffers from seizures stated that, "My dog senses when a seizure is about to come on, and his touch stops it." Another veteran who owns a service dog who is suffering from PTSD stated that, "I could not be in malls or other crowded places. Now with my dog, I can tolerate them, knowing he will rescue me." Service dogs provide so much benefit to occupational therapy. OTs can help veterans train their dogs, help them adapt to their new dogs, and make any adaptations to make the service dogs more successful in the therapy and in the veterans' lives. Service dogs greatly impact success with veterans.
Hi, I'm here to talk about horses and their therapeutic benefit to helping veterans. Horses are also used as a type of animal-assisted therapy to help veterans. The therapeutic benefits of horses date back to 460 BC. There are many historical references to the physical and psychological benefits of riding. In 1969, the North American Riding for the Handicapped Association was founded. They served as an advisory body for riding organizations across the U.S. Therapeutic horseback riding has numerous positive physical effects, as well as cognitive, memory, motor control, and improvement in self-esteem and socialization skills. The horse's gait is very similar to the human's gait. In a study with patients who had multiple sclerosis, it was found that after 10 weeks of riding, there was an improvement in balance, pain, ADLs, self-confidence, less fear of movement, and decreased muscle tension. Therapeutic horseback riding and hippotherapy can be beneficial to veterans who have both physical disabilities as well as mental distress from war. Hippotherapy utilizes the fields of physical, occupational, and speech therapy. It focuses on neuromuscular function. The functional outcomes depend on the therapist driving the horse. Occupational therapy is going to be focused on the rider's attention, cognitive level, fine motor and gross motor control, ADLs, and sensory integration. In hippotherapy treatment, the rider does not move the horse. It is the therapist who is controlling the horse's movement. In therapeutic horseback riding, the rider facilitates the horse's movement. Both styles of riding can be used to treat veterans. Hippotherapy is more appropriate for veterans who have sustained a serious injury. Therapeutic horseback riding may be more appropriate for veterans who struggle with PTSD symptoms. It can help them with socialization, empowerment, relaxation, and much more. In a case study done, there was a 44-year-old veteran who suffered from a spinal cord injury. Before the therapeutic riding session began, the veteran was assessed using the American Spinal Injury Association Impairment Scale. The scale assesses the neurological level of both motor and sensory function. There is little to no equipment required for this assessment. The major muscle groups are assessed on a 6-point scale, 0 to 5. Perception of light touch or pinprick sensation is graded on a scale of 0 to 2. The veteran is non-ambulatory, body awareness and static sitting balance were good, his fine motor control was functional, He used adaptive strategies and was able to grasp using both hands, and he had a strong flexor pattern and high tone, which was good for guiding the horse. His upper extremity strength was 3 out of 5, and his trunk and lower extremity strength was low to average. He demonstrated good core strength. During each treatment, the veteran was assisted by an instructor as well as 2 side riders. The veteran was referred to Therapeutic Riding Center by his medical team, which included nurses, an occupational therapist, physical therapist, and his physician. After a few treatment sessions, the veteran reported feeling more confident. The veteran stated that he was able to know which muscles he was working at home. This motivates him to work more, and riding helps him to work out his muscles so that he is able to stand for longer. After years, the rider reported decreased muscle spasms and increased muscle strength. His posture, balance, and core strength improved. He also describes many emotional benefits of the experience. He loved to be outdoors and experience the horse's movement. He was able to have social interactions with the volunteers and the instructors. This provided satisfying emotional and social benefits. The Saratoga War Horse Project was a case study that focused on the connection method. This method helps soldiers returning home feel a sense of empowerment, trust, emotional control, decreased anxiety, decreased depression, and improving physical and social functioning. The Connection program is an interactive environment where the soldier learns to instruct the horse. The horse willingly takes instruction from the soldier, and they both gain trust in one another. This relationship between the horse and the soldier helps the veteran feel a sense of empowerment. This study used several assessments to evaluate this intervention. The assessments looked at depression, stress, quality of life, social support, and cognitive flexibility. The study was conducted over a 12-week period. The veteran learned methods to instruct and take care of his horse. After the study was over, he showed significant improvement in psychological functioning. Hippotherapy and therapeutic horseback riding focus on improving physical and mental function of their clients. Many of the principles used for these interventions are within occupational therapy's scope of practice. Many of veterans who return home, injured or not, struggle with PTSD, have trouble socializing, and tend to feel isolated. It becomes harder to make connections, sleep participation is disrupted, self-care can also significantly decline. Occupational therapists can play a vital role in caring for veterans with physical and psychological issues. Using animal-assisted therapy can help the client open up and participate in treatment that they may not normally participate in. The bonding and companionship that come along with animals can make a significant change in the veteran's life.
Thank you for listening to our speech.
Have a great day.